Regions of the peritoneal cavity. From surgical point of view, the peritoneal cavity has basically two main parts, the abdominal cavity proper and the pelvic cavity. The abdominal cavity is further divided by the transverse colon and the transverse mesocolon into a supracolic compartment and an infracolic compartment. So you can see over here, this is the transverse mesocolon, this is the supracolic compartment, and this is your infracolic compartment. Now, the supracolic compartment is subdivided by the reflection of peritoneum around the liver into a number of subphrenic spaces, right? Subphrenic, that is below the diaphragm. So the supracolic compartment, also called the subphrenic space. Whereas the infracolic compartment is subdivided into a right and the left part by this mesentery over here. This is the right paracolic gutter, lies along the lateral side of the ascending colon, and the left paracolic gutter along the lateral side of the descending colon. Coming to the supracolic compartment or the subphrenic spaces. The subphrenic spaces, as the name suggests, lie just below the diaphragm in relation to the liver. So if you want to classify the supracolic compartment, it has intraperitoneal spaces and the extraperitoneal spaces. The intraperitoneal spaces is, as you can see, lined by the peritoneum, whereas the extraperitoneal spaces is not lined by peritoneum. It is basically your bare area of the liver. That is the midline extraperitoneal space, whereas we also have the right and the left extraperitoneal space. Coming to the peritoneal spaces of the supracolic compartment, right? So like I mentioned, there was a left space and a right space. The right space and the left space further divided into an anterior and a posterior space. Now, so this is the left side, left lobe of the liver. So anteriorly placed is the left subphrenic space that is lying between the left lobe of the liver and the diaphragm, in front of the left triangular ligament. Inferiorly, it is extending in front of the lesser omentum and that of the stomach. On to the left side, it is reaching the spleen. So, an abscess may form in this space following operations on the stomach, the spleen, or the splenic flexure of the colon, also the talar pancreas. Now, left posterior space, posterior to this, or the left subhepatic space, it is nothing but merely the lesser sac. As you can see, left posteriorly placed, it is subhepatic space or just the lesser sac. Now, coming to the anterior space or the right subphrenic space lies between the right lobe of the liver and the diaphragm, in front of the superior layer of the coronary ligament and the right triangular ligament. Infection may spread into the space from the gallbladder or the vermiform appendix or operations on the upper abdomen. The right posterior space is the right subhepatic space, also called the hepato-renal pouch of Morrison. The left extraperitoneal, now this is the extraperitoneal space, lies around the left suprarenal gland and the upper pole of the left kidney, also the site of left perinephric abscess, whereas the right extraperitoneal space lies around the upper pole of the right kidney. Now, the midline extraperitoneal space corresponds to the bare area of the liver, right? It is lying between the bare area and the diaphragm, bounded above and below by the superior and the inferior coronary ligaments. Infection can spread to the space from the liver, resulting in liver abscess. Now, very important, the hepatorenal pouch or the Morrison's pouch. Coming to the boundaries first, anteriorly we have the inferior surface of the right lobe of the liver and the gallbladder. Posteriorly, we have the right suprarenal gland, upper part of the right kidney, second part of the duodenum, hepatic flexure of the colon, the transverse mesocolon, and a part of head of pancreas. Superiorly, we have the inferior coronary ligament. Inferiorly, it is opening into the general peritoneal cavity. Right, so this is about the hepatorenal pouch. Left, right, can you see the kidney and the suprarenal gland? This is the same space over here. Left, it communicates with the omental bursa, and right, it is limited by the duct.